Welcome to this symposium that will introduce you to Health Data Research Network Canada. I'm Lisa Lex from the University of Manitoba in Canada, and I will be chairing this session. Two of my colleagues who are providing leadership to HDRN Canada have joined me. Kim McGrail, who's at the University of British Columbia, and Brent, who's with the Canadian Institute for Health Information. Kim serves as Scientific Director for HDRN Canada and leads a 7-year grant from our National Health Funder to support this work. And she is Scientific Director of the network. Brent Diverty serves on the Executive Committee and helps to provide oversight for many of the activities in Health Data Research Network Canada. And I chair the Algorithms and Harmonized Data Working Group with the network. So I'd like to turn it over to Kim, who will lead us off in describing the work that HDRN Canada envisions doing and has already begun to achieve.
Thank you, Lisa, and welcome everybody. So Health Data Research Network Canada is a newly incorporated nonprofit based in Canada that is made up of provincial, territorial and pan-Canadian organizations that have a role in managing, providing access to data, and some other interested parties as well. So we came together as a group and responded to a call from CIHR, as Lisa said, our national funding agency for health research, because we believed that there was a reason for all of us to be working together. This is to share expertise, to find opportunities for collaboration, and to foster innovation in research. Next slide. So the organizations that make up HDRN, as I'll call it, are really come from across the country, as the previous map in this slide show. We cover all of the 10 provinces in the country, as well as one territory. We're working on bringing the other 2 territories in, and 2 national agencies, Canadian Institute for Health Information and Statistics Canada. As you can see, the people who are part of HDRN come from academic organizations and research organizations and statistical agencies and so on. So it's a wide variety of different organizations. The vision for HDRN is that we are a distributed network that facilitates and accelerates multi-jurisdictional research. Like other countries, we are, well, like many other countries, we're a federated society, and we have provinces, territories, and a federal government, and with different jurisdictional responsibilities, with health and social services really being the responsibility of provinces and territories. And so this creates opportunities in terms of a natural laboratory for research, but also challenges in terms of different data collection, different data resources, and so on. And this is the challenge we're trying to address in order to enable multi-jurisdictional and pan-Canadian research. So our work has 7 overall objectives, and they are to, first of all, build a one-stop shop data access support system and to provide algorithms and harmonized data to support research. And you'll hear more about both of those things in a bit. We're also working to continuously expand the types and sources of data that we can make available to research. We are developing technology that can help support efficiency in all of the processes that we provide. And this will also help us with sustainability. We're creating supports for distributed analysis and other kinds of advanced analytics. We are ensuring that we have strong support from the public and from Indigenous communities and others for the work that we're doing, given that we're so heavily data focused. And we are, of course, paying attention to governance of the whole system and keeping our network focused on responding to priorities and being internally strong as well. So as I've already mentioned a bit, the biggest challenge for research is that that data are different in different locations, and they have different processes for researchers who want to access them. So we have both a challenge of process and a challenge of the content of the research data. And we really are wanting to make sure that what we can provide to researchers is supports both for working through the process of getting data, but then also supports so that they have apples to apples comparisons and can do better research. Next slide. And we're starting from the principle that we really are almost there. We have really, really strong individual data centers across the country and in our pan-Canadian agencies. There's lots of resources in place to support research, but there's this extra layer on top that needs to be developed so that we really can do more multi-province studies and pan-Canadian studies. And this leads us to a few principles for the way that we're working together. One is that we're a distributed network with distributed funding. So we're not creating a central data storage system. We're not creating a central physical infrastructure. We're really trying to treat this as a bit of a nation building exercise in ensuring that every part of our country has the capacity to work with us and to be able to use their own local data in really compelling and high quality ways. We are, in that sense, respecting the local context and policy environment. We're not requiring that organizations act a certain way or have a certain way of doing things before they join with us. We're taking everybody as they come and then hoping over time that we can learn from each other, which is likely to create a bit of convergence in the way that we do things. We're really committed to leveraging what other people have already developed and sharing wherever possible so that we can spend more time doing things better by sharing. So if we develop one thing in a province, it doesn't have to be redeveloped elsewhere. We can just share that. And we're open to ideas, input, and opportunities as they come along, because we do want to be responsive to the changing nature of what researchers hope to accomplish in their programs of research. So I'm sure this is very difficult to read. It's really just meant to give you an overall sense of the kinds of and depth of data that we have. This, of course, also highlights that the data we have across provinces and territories and at the pan-Canadian level are a bit different. There's some foundational things that are similar with a lot of data in the healthcare sector being available in all of our jurisdictions. And then we get into more spotty coverage for social data and other kinds of data holdings. More information is available about this, and Brent will be talking more about that a bit too. Next slide. So just a few key milestones for you. We submitted the grant application in June of 2018. We found out that we received the grant late in 2018, but really because of the nature of getting something like this underway, it was not formally announced until April of 2019 with an announcement by our Federal Minister of Health. In January 2020, so just this year, we were established as a nonprofit and we launched our Data Access Support Hub in February of this year. And in April, responding to current situation, we started a COVID-19 related briefing note that would help to identify the kinds of resources that we could make available for multi-province studies. Next slide. So as you can see from everything I've said, there's a few key pieces, one of which is that no one network or one site has all the data. That's also true if we think about HDRN in comparison to other groups that also hold data, and no one network is ever going to have all the data that researchers might want to use for their projects. So one of the things that we have is this mandate to expand the available data. We understand that there's a lot of complexity there, and so we're developing a partnership or alliance model that is intended to help expand the data that we have purely by working in partnership with other data holding organizations. And next slide. And then the last thing I want to cover really is that we acknowledge that data may not always be available in one location for analysis. So it's becoming, and this is something that we knew was on the horizon, but we've accelerated a bit the work that will help support this distributed analysis. So we know that researchers would like to combine data from multiple jurisdictions into one place. We're working on a legislative review to understand where that can or might be possible. We're also working on a statistical review because we understand that not everything needs to be in one place in all cases to do really high quality analyses. And finally, we're working on a secure environment review to understand how we might be able to connect our secure environments to support really high, the most efficient and scientifically sound distributed analysis. And with that, I'll hand it over to Brent.
Thanks, Kim. One of the early areas of focus for the network was creating an access point, a front door, so to speak. And we call this the Data Access Support Hub, or DASH for short. As Kim mentioned, we opened this DASH in February 2020 as a single stop online portal where researchers can interact with a website and request access to data from our multiple participating data centers in the various provinces and territories across the country, and with the two federal partners, ourselves and Canadian Institute for Health Information and Statistics Canada. Canadian Institute for Health Information, or CIHI as we're known, leads the DASH effort, but this is a strong partnership across the HDRN Canada partner data centers, where we have embedded staff in each participating data center whose job it is to fully commit their time to this effort. And we think this has been really crucial in us allowing to get where we are right out of the gate. This is, so staff are not doing these types of requests off the sides of their desk in the various tasks of the network. We actually have the people in place first, with technology to follow. And to date, we've been involved with over 20 multi-jurisdictional data requests, and we continue to work with some of those requesters, and others are coming along as well as we go. So with the principle of a distributed network being at our core, this really influenced the objectives of our network, which center around four key things. First of all, a desire to make local processes transparent and provide coordinated support, a concierge service, if you will, across the centers, because many of these processes are not harmonized at this point in time. Second of all, a second objective being supporting researchers in navigating data sharing issues and analytic design options. So again, you could think of this as a consulting service to go with the concierge service. And over time, two other objectives we aim to realize are to harmonize where possible and where allowed data access processes across partner data centers, and to streamline and progressively automate the request process. One of the early deliverables from DASH was a website, which can be found within the hdrn.ca overall site. Is the website with a series of inventories and information products there, as you can see on this slide. We have cataloged across the country from our participating centers more than 380 data sets available for request, and noted where they're common across different provinces and territories in Canada. Also of note, and Lisa's going to talk about this in more detail in a moment, is an inventory of algorithms that are, provide sort of common or harmonized or lead to common or harmonized data across different centers and across different jurisdictions. So more from Lisa on that. Another important piece is not only are we aware of the different data access requirements and procedures at the different centers across Canada, but we have essentially a framework for documenting those in a consistent way, and are able to make that available to requesters so they understand all of the different steps involved in the different centers and all the different requirements. And as I mentioned, those can be quite different from jurisdiction to jurisdiction, or depending on the type of data. And finally, the last thing that's there at the moment is a high-level online request intake form that starts off your a researcher's inquiry or journey with the DASH portal. As expected, the global pandemic has been a focus of recent activity for the network as a whole and the DASH in particular. The DASH team across the country has supported a few specific projects that are underway and many research funding proposals assisting with cost estimates, feasibility assessments, etc., across a range of domains, as noted on the slide, and several others. And one of the new areas Kim was mentioning already, that progressively over time, as the participating centers add more data to their own inventories, we will make those available through the DASH as well. And one of those at the moment is COVID-19 test result data. So as many of our jurisdictions begin to have that data available for research within their jurisdiction, we're progressively adding those to our inventory and bringing them into the feasibility discussions. So as we move forward, having set up the basic infrastructure and staff across the country's many data centers, some areas for focus in the coming months and years are here summarized on this slide. One of them is a common data request form that takes into account the requirements of all the centers across the country, but does that in a single form with some technology in the background that allows us to cover off all the requirements. A second important area is to look at the various governance and requirements around access to data about Canada's Indigenous peoples, and ensuring we understand and have documented those, in some cases, unique requirements for the various data sets and in the various jurisdictions. Another area we're working first on documentation, but with an intent to progressively harmonize over time, is around data linkage processes, and similarly data de-identification processes. I think the network provides an opportunity for shared learning in areas like these where, you know, of course, we, I'm sure in many countries, we have the same issue, which is many organizations within a country trying to solve the same issues. And working together, we should be able to solve them quicker and agree on standardization or harmonized processes. And that's what we're focused on here. And similarly, again, with data access process harmonization, looking at some things like pricing policies for around cost recovery, trying to make ethics review processes more efficient, etc. These are things we will work on progressively over time, making adjustments where local legislation and policy allows. And finally, looking at, and Kim mentioned these in her remarks, just looking at how we can benefit from an analysis of our privacy and legislative framework and some of the options around technology, again, to make the network more harmonized and more efficient over time, allowing researchers to spend more time conducting research and less time assembling the data that they require for a project. So with that, I'll pass it over to Lisa to continue the presentation.
Thank you, Brent. Now I have the opportunity to describe for you one of the working groups that has been very active since the formation of Health Data Research Network Canada. The Algorithms and Harmonized Data Working Group includes representatives from across Canada, as well as from Statistics Canada and the Canadian Institute for Health Information, who have interest in how we can achieve efficiencies and really economies of scale around the documentation of our data resources, and also measures that have already been developed about how we are able to measure key concepts of population health, health service use, and the determinants of health in common across the provinces and territories. Both Kim and Brent have alluded to the fact that deliverables that have arisen from the work of this particular group include our inventory of the databases that exist at our partner organizations, and that's available through the DASH website. And then an inventory of algorithms that enable us to measure in common. And these have come to date from systematic reviews that have been done by staff at the University of Manitoba. And all of these measures have been validated, in other words, assessed for their accuracy or tested for how feasibly they can be implemented across the diverse databases that comprise the partner data sites in HDRN Canada. And so they have to have been assessed in 2 or more provinces or territories in order to be included in the inventory. So why exactly so much emphasis on algorithms and harmonized data? Well, while we recognize, as Kim has noted, the importance of partnerships in data, and that will help to ensure that there's a commonality of purpose in terms of where we're going. We also recognize that standard approaches to data-related tasks can help us to be efficient in the process so that we can conduct research in a timely manner and ensure that it is available to decision makers and policy audiences to support timely decision-making in the healthcare system. And standardization allows us to ensure that what we're actually doing will be to compare apples and apples and to help us check on the accuracy and really the reliability of our results as well. And our look forward to harmonizing data enables us to provide users with views of the data that are comparable. And this is particularly important as we look at standardizing code so that studies can be run very efficiently using statistical software code from one jurisdiction to the next. And again, that can really help to achieve efficiencies in the work that we do so that it is timely. A little bit around the data assets inventory. So work continues to proceed despite the fact that we have an inventory now of many data sets that exist across Canada. We created a standardized template for data collection and helped to implement that in the sites. We're working now on standardized labels that will enable us to quickly and efficiently search for different kinds of data and information contained in those. And that will be helpful again so that work can proceed efficiently. And we're working with ontologists to help ensure that we have harmonization in the data labels across other jurisdictions as well, and that we can support the annotation work that needs to happen with the data assets inventory so that everyone is working in common to attach labels to the data sets from their own jurisdiction. Kim and Brent have alluded to the importance of us ensuring that we have timely data around the coronavirus pandemic. And so the Algorithms and Harmonized Data Working Group has spent time conducting surveys of the provinces that have test result data, looking at what's in common around these databases and the availability of different kinds of information, with the goal eventually to harmonize the fields and the descriptions of the information that is available. I'll turn now to talking about the algorithms inventory, which is that tool that is available online to report on measures that have been assessed for their validity or feasibility across multiple provinces and territories. The systematic reviews that we have done have resulted in standardized data being extracted, and the working group has participated in identifying relevant fields. We've had multiple individuals who have worked through that process to ensure that the results are reliable and consistent. The working group has gone back and forth to say what would be most relevant to researchers and how can we assure that it is searchable and usable. And we've done quality control checks involving the authors of the studies included in the systematic review. We initially started with work around measures of population health, focusing on chronic and acute health conditions, because we knew from our own experiences in the Algorithms and Harmonized Data Working Group that there were many validation studies that have been done about chronic diseases in Canada. In fact, Canada tends to lead in this area across many countries worldwide. Now that that work has been included in the algorithms inventory, we're working on looking at measures that allow us to assess the determinants of health, such as income level and race and ethnicity, which are important for doing equity analyses. Many of these measures are based on Statistics Canada census data that, of course, is common across the provinces and territories, and thus enables us to measure these kinds of constructs in a consistent way. And after that, we'll focus on healthcare measures. We've done a little bit of work around this initially, but we'd like to look more intensively at commonalities in measures, such as for different surgical procedures and healthcare interventions, and high users of the healthcare system, such as those that are high cost users. In addition to this work, we have a number of projects that are ongoing. One of the most exciting for us is that we issued a call for proposals, inviting research teams from across Canada to submit proposals about how they would help us to expand the algorithms inventory. And this involves collaborations between experienced teams of researchers and the network. And it will also help to test the use of the DASH system itself and how to engage multiple partners in studies. We're looking at also developing a process that can be standardized across Canada in terms of how we do validation studies of measures of population health, health service use, and the determinants of health. So this call for proposals is helping us to achieve a process map and standardized analytic protocols that could be used for this purpose. And finally, common data models that will facilitate the process of harmonization of key data sets that are available across the provinces and territories can help us be efficient in implementing common queries, or in other words, standardized software applications that could support comparability of studies. So with that, Kim and Brent and I have given you an overview of Health Data Research Network Canada services and tools and the exciting initiatives that are underway. We've been focusing on our Canadian research audience, but we're here today with you at this conference in recognition of the fact that we do want to engage in discussions with international partners to talk about where there may be overlap in projects, for example, around common data models or the development of metadata that could benefit many sites worldwide. So on behalf of Kim and Brent and myself, I'd like to thank you for watching this symposium. And if you'd like more information, we have it available here on the website for the network and also for DASH. Thank you for listening.